part 3 of how to be an art therapist in a mental health facility. Here's another big one, and my list keeps getting on and on, I'm finding, but this is also really big, is don't take things personally. So this just comes with the job where you need to step back and really take a look at the whole situation. Perfect example is you're running a group and somebody walks out of your group room. So most people would take that personally and say, wow, what did I say? Did I offend them? But in a mental health facility, it is completely different. This is something that I've learned to just ignore because people have different reasons why they don't stay for a group, whether maybe they're not feeling well from taking all the medication, maybe their head just isn't there, maybe they're just having a moment, and you just have to let it go. It is not you, it is them, and you have to make allowances and give them grace. And part of that grace is also keeping eyes on your other patients, making sure they're not disturbed, and keeping the flow. So if you do notice people that are staying in the facility, because this is a crisis center and people do stay short term, but they get to know other patients and know their quirks and things that they can expect from them. So for me, it's a learning experience and it doesn't take long to figure it out, but it's really important that you do kind of monitor the room, keep the vibe. And in an art therapy group, you want to maintain that peace and that calm that you're trying to bring to them for that small amount of time that they're with you. And another thing that I'm responsible for is kind of going to the scene. So if somebody is elevated and needs assistance, that is me that will go there. Most of the time though, there are other people that are involved, other clinicians and even some nurses. So what I do is then I tend to the patients and I make sure that they're calm. So it's all about just being supportive and meeting them where they're at. So that's part of the art therapy end of it, along with doing some art, of course. But there's a lot of different aspects to my job that a lot of people don't know about, and that's why I'm here to educate you. Tune in tomorrow, I got more. I'm Jean and I'm an art therapist.